Hello, I'm Dr. Ananya with specialty in laparoscopy and cosmetic gynecology. I'm going to speak about hymenoplasty. So hymenoplasty is a reconstructive procedure where the hymen is resutured following the rupture of the hymen. So hymen, first I will let you know what's a hymen. Hymen is a mucous membrane which is present over the outside introital area of the vagina. It can break down during the first intercourse or following physical activity like cycling or riding a horse or any other such activities. Or it may break following any surgical procedure. Hymenoplasty has been introduced in Pristyn care and it is done in an OPD basis. What we do here, we resuture the hymen by cutting the edges and then resuturing it with soluble sutures. The sutures take 1 to 2 weeks to heal. Following the procedure of hymenoplasty, patients are told to apply ointment and use antibiotics for 5 days. They are told not to apply any sprayed or irritants over the area.
Book your surgery appointment on PristynCare.com. Pristyn Care.